again here. So thank you all for joining us for today's briefing. I'm going to start with a brief statement that I have regarding Governor Cuomo's resignation today, and then Dr. Mendoza and I are going to move forward with addressing the COVID-19 pandemic and with this week's update. Governor Cuomo's decision to step down today is the right thing to do, given the seriousness of the findings in the Attorney General's report. The governor had lost the confidence of the people of the state of New York and his partners in government, and this allows our state to move forward. I am grateful for the courageous women who came forward to expose this behavior and to ensure that a person in a position of extraordinary power is held accountable. I have known Lieutenant Governor Hochul for a decade now and have full faith and confidence in her ability to lead our state forward. Once sworn in, she will become the first woman to serve as governor, the highest office in New York State. Lieutenant Governor Hochul is a thoughtful leader who knows the issues that impact New York State well. She has served in every level of government, from local government, county government, state government, and the federal government. And I look forward to working with her on behalf of all of Monroe County's residents. And with that, Dr. Mendoza and I have an update to provide on the COVID-19 pandemic. Exactly 1 year ago, on August 10th of 2020, we reported 20 new cases of COVID-19. Only 3 of those cases involved young people, none of whom were under the age of 10. What a difference a year makes. Today, we're averaging more than 100 new cases a day. Over the past week, 118 of our young people were diagnosed with COVID. Nearly half of them were under the age of 10. Currently, there are about 60 COVID patients in area hospitals. Over the past, with 1 or 2 exceptions, the hospitalized individuals are unvaccinated, and a quarter of them are in the ICU. There are also at least 3 children under the age of 19 who are suffering from severe cases of COVID-19. Public health experts across the nation are raising alarms about the surge in COVID hospitalization amongst children, most of them too young to receive the vaccine. Our children are increasingly vulnerable as this virus mutates and spreads. Those under 12 cannot yet receive a vaccine to help them fight this virus and its most severe side effects. That is what we have to consider as we're preparing to reopen our schools for 5 days a week. Today, the New York State Department of Education announced it will provide reopening guidance for districts. Here in Monroe County, Dr. Mendoza and his team are working with area school districts and is developing recommendations regarding how to open schools safely come September. This will allow each district to work with their stakeholders to determine what makes the most sense in their community. And Dr. Mendoza, I know we'll talk about this process a little bit more in just a moment. With all of this in the works, we must not lose sight of one very important fact. The leading public health prevention strategy to end the COVID-19 pandemic and make in-person learning for all of our students possible, extracurricular activities, and sports as safe as we can for our children, is vaccination. Right now, Monroe County, 453,677 residents have had at least 1 vaccine dose, with 407,000 fully vaccinated. That amounts to 70.6% of the 12-plus population having had at least 1 vaccine dose, and 63.5% of the 12-plus population fully vaccinated. If you're eligible to be vaccinated, I urge you to do so now. While our vaccination numbers are good when compared to many other parts of the country, as Dr. Mendoza will explain, they're not yet high enough to keep the highly contagious Delta variant from circulating in our community. It will help control the spread of the disease. The vaccine will help protect the most vulnerable amongst us, including our children. This week alone, Monroe County is operating 19 different vaccination pods across our community, many of them located in neighborhoods with our lowest vaccination rates. Information about all of our pods can be found on our website at monroecounty.gov. Appointments are available for most, but walk-ins are always accepted and they're always encouraged. So please, if you are not vaccinated and you are eligible, please do so today. Please consult with your healthcare professional, your doctor, if you have any questions at all, and make the right decision for yourself. But we know that the vaccine is the best way that we can fight the pandemic, fight the Delta variant, and make sure that we are as healthy and safe as possible. With that, I'll turn it over to Dr. Mendoza.
Good afternoon. Thank you, County Executive Bello, and as always, thank you to the members of the press. As the County Executive points out, we are in a very different place than we were last year at this time. Though we had hoped that warm weather, being outdoors, and the ready availability of safe, effective vaccines would make this summer feel pretty close to normal, the reality is that it's not. As you know, we are seeing dramatic increases in new cases each week. While the hospitalization numbers are still relatively low compared to the peak of COVID, they are also increasing dramatically each week, especially among unvaccinated individuals. How is it spreading and what can we do about it? My team has seen a few trends lately. First, a significant percent of the new cases, 10% or more, can be connected to travel to Florida or to visitors who have come here from Florida to stay with family or friends in Rochester. We are also seeing a lot of transmission in small workplaces. People are coming to work with symptoms and spreading it among their coworkers. And much of the transmission is happening in households. A child may be exposed to COVID at camp, and then we see that child's whole family test positive a few days later. That's how it is spreading. And these patterns are not new. We've seen these patterns before, and we need to think back to what we've learned before in order to get through this new phase of the pandemic. Vaccination remains by far the most effective way to get all of us through this pandemic. And there are still a few additional steps that we should all consider, especially for those who are not vaccinated. Masking, especially indoors in public places, is highly recommended. That means masking in common areas at your office, inside grocery stores, and when going indoors for activities at summer camp. Carrying a mask around may take a little getting used to again, but I know we can do this because we've done it before. Really think carefully about your gatherings with family and friends, especially larger gatherings like weddings and reunions. While testing is no longer required, it is never a bad idea to consider testing in addition to vaccination and masking. These steps are so important as we prepare to reopen our schools in less than 1 month. Our youngest kids are not vaccinated and they are still vulnerable. We are working closely with schools to help them get ready and to overcome the challenges that they face. While we await updated guidance from the State Education Department, I am recommending that schools follow the CDC guidance as closely as possible. Here in the Health Department, we are working very closely with our partners in the healthcare system to develop updated algorithms so schools can have plans in place when students come or staff come to school showing symptoms and or test positive for COVID. The work is just beginning and we're excited to get along with this school year, but in order to do so, we need to take all of the steps possible that we can to keep all of our community, especially our kids, healthy and safe. And with that, I will turn it back over to County Executive Bello.
Great. Thank you, Dr. Mendoza, and we can open it up to questions from the media.
All right, our first question comes from Jayne Chacko from 13 WHAM.
Hi, everyone. I know the hope is that for things to get out of control before the start of the school year, but realistically, are you expecting a surge for children getting COVID once the school year begins, if schools reopen fully? I know that's the plan. And are hospitals able to accommodate if many kids end up in the hospital?
Well, for now, we need to prepare for all of these scenarios. Most of the experience that we're learning from across the country and across the globe suggests that the Delta variant may not last very long. So hopefully we can get through this shorter surge. Perhaps we'll start the year off in a better place than we are right now. And that's certainly everybody's hope. But the reality is that we are learning something new every single day and we have to stay prepared. And the best that we can do is take control over the things that we can control. And that is getting a vaccine, wearing our mask, understanding the precautions that we all know how to take, and doing everything we can to keep our kids safe.
And just to ask a question about kids in the hospital. I know 3 have very severe cases of COVID. If the Delta variant does impact children more severely as school starts, are hospitals prepared to take on that?
Well, as we mentioned before, our hospitals are nowhere near as full as they were at the peak of COVID. So there is still room. But that is not a luxury that we want to take advantage of. So right now we can handle things, but we don't want to tax these hospitals any more than we have to. And more importantly, we don't want to see kids get sick. So if we can prevent children from getting sick, that's certainly the most desirable outcome.
Thank you.
Thank you, Jayne. Next up is Will Astor from Rochester Beacon.
Okay, my question is for Dr. Mendoza. Do we have a picture of the demographics of the unvaccinated who form the bulk of the hospitalized? Are most of them individuals who were eligible but didn't, or is a significant portion people who were children or otherwise ineligible?
So thanks for that question. We are working on providing more detailed demographics of the vaccinated and unvaccinated cases. Certainly all of the children under the age of 12 are unvaccinated, and there are a significant proportion of them who are in the hospital. But the reality is that most of the people in the hospital are unvaccinated for one reason or another. So we'll gather some of those data for you, as soon as we can. But the reality is that hospitalization for now is primarily a condition for those who are unvaccinated.
And do you have any notion of whether or when we might see boosters for the double vaccinated or fully vaccinated?
So the Advisory Committee on Immunization Practices, which is a committee of the CDC at the federal level, is going to be meeting on Friday. I understand that they're going to be taking up the question of boosters specifically. So I anticipate we'll learn more by the end of the week.
Okay.
Thanks, Will.
Okay, thanks.
Patti Singer from Minority Reporter.
Hi, thank you. Early on, there was some data about the burden of disease among Black and Hispanic people, but now that the focus is shifted to vaccines, we're not hearing much about the burden of disease, how many people are becoming ill. How is it publicly being reported, the number of cases in Black and Latino communities, so we know the effectiveness of the vaccine? I'm not seeing it easily accessible on any website of what the burden of disease is in those communities. Thank you.
So that is a program that we've been working with the Center for Community Health and Prevention. They have had to shift their priorities away from that project, so we're not able to get the data as quickly as we had been in the past. Certainly very important, obviously, and we're going to work to get those data again. So more to come.
Okay, as a follow-up with the state ed, and you're recommending districts follow CDC, is it potentially possible that every district would have its own protocol? And then that could be confusing for, families. A parent may teach in one district, the kids go to another district. How do you want to kind of herd the cats on this to make sure that Monroe County is acting with one voice and it's not every district for themselves?
Well, this is where I give a lot of credit to our superintendents and school district leaders across the county. We've been working together from the beginning of the pandemic and having similar protocols. This goes back to even when schools were closed, when schools reopened, what the protocols were for that. And so I anticipate that the reopening guidelines will be similar across the schools. They've been working together on these plans, and they will continue to work together, I think, between now and when school opens.
Thanks.
You're welcome.
Thank you, Patti. I'm not sure, do we have Alex Love on from WROC or any journalist? Good, you're up.
So my understanding, and I believe I've received that letter as well, the state ed department is going to oversee the education half of things, if you will. And we in the CDC's recommendation will oversee the public health aspects of things. The operation of schools is at the discretion of the districts and their boards, and our job is to make recommendations. My understanding is that state ed is going to limit their focus, as they would, to the elements of education and instructional delivery, and they will be leaving the public health aspects to us. So more to come as I understand it, but here in Monroe County, we've been very clear, I've been very clear with the superintendents that, I can't give advice and guidance on how to operate a school, but our role is to offer advice around the public health measures. And so my anticipation is that the state ed department will do the same. So again, my advice hasn't changed. Whether we mandate it or recommend it, the reality is wearing a mask is a very good idea. And we want our businesses to follow the guidance that keeps them in business. And my belief is that a business that provides for the health and safety of their customers is going to be a heavily patient business. I'm not in a position to mandate anything for businesses. That is something that we talk about. But from my standpoint, my goal is to provide education, clarity, to give advice from the health standpoint, and then let policymakers determine what level of implementation is necessary. But we've been through this before. I don't think anything that I've shared today is anything new. I believe that our community knows what to do. And the hard part is that we need to remind ourselves that we've got to do it all over again to some degree. We don't want to go into the throes of 2020 like we had last year. And I believe that if we follow the guidance, as different as it is, as difficult as it is, we'll get through this together.
Thank you. And our final questions are from Racquel Stephen from WXXI.
Yes, hi, good afternoon. Thank you. My question, I guess, is for Dr. Mendoza or our county exec. Is there a worst case scenario where you see schools not reopening fully this coming school year? What would be the worst case scenario where we would not do that, just go full remote or hybrid?
So I really don't foresee a path where a school can't reopen fully. I think the worst case scenario would be if there's an outbreak in a school and people weren't masked, and we'd be forced to quarantine people. And if we had to quarantine enough people, whether they're students or worse, teachers or bus drivers, that would preclude many school buildings from being open. So, that's really an issue of logistics that unfortunately would occur if people didn't follow guidelines. But what I've told the school districts is if everybody wears a mask, even if there is COVID, if everybody's wearing a mask, our current guidelines would say that we would not have to quarantine those individuals. And people who are vaccinated are even more protected. So the path towards staying open after a full reopening is actually quite clear if we follow the guidance. The challenge is in implementing the guidance, and that's the hard work that our superintendents have to consider in the weeks ahead.
I don't know if you can respond to this or not, Dr. Mendoza, but Livingston County has chosen not to adapt these indoor masking mandates or requirements. How would you respond to that? Do you have a response at all?
Well, every county is different. I can't pretend to know how things go in Livingston County. They're certainly less populated, and they may have more space in their schools than our schools have here. But from the experience that I've gained over the last year, I think wearing a mask in our schools will be very, very important to keep transmissions at a minimum.
Thank you so much.
Okay, I think that does it for questions today. Thank you, everybody.
Thank you, everyone.